In this clinical video, we're going to be using the LTM precise laser to do a little gingivectomy procedure. The patient is not happy with the length of her teeth. So we're going to go around and probe. As you can see, her gum tissue is very healthy. There's plenty of attached gingival tissue. And as we probe, we just have 2 to 3 millimeters. Now, when we look at our sulcus depth, we have to be aware that when we're just doing a soft tissue procedure, we will be limited to how much tissue we can actually take away. So here we're starting to take a little tissue away. We're not going to be taking a lot of tissue away for the patient, but just enough to make the teeth appear a little longer, give a little more length and a little more cosmetic appearance. So you can see we're just running the laser along, gently removing that gingival tissue, using it sort of in a paintbrush motion. You can see the tissue is just literally being wiped away, starting with the canine there. The setting for this is we're using 1 watt continuous. Now, just dragging it along there, little paintbrush motion again, taking a little tissue away. We are getting just a little slight charring, which will be taken care of at the end. We'll just use a micro brush to gently take that away. It's very superficial. It's not going to cause any recession or any problems, post-op problems for the patient. So again, just slight angulation to create somewhat of a bevel when we remove that tissue. And you can see the laterals gaining a little length. Just real nice procedure. As we get over to the central, you'll notice that the other central, number 8, had been, we had done the opposite side the day prior. And just because the patient had a time constraint, we had to have her come back, and we could only do one area at a time. So you can see that after 24 hours, the healing is very nice. There's a little redness, which is to be expected. The post-op for the patient was to gently brush the area. And now we're just going to try to match up the left side, the left anterior teeth, to match the right side that was done 1 day prior. So again, sort of a sweeping motion, just going along, just gently removing that tissue. You have to remember that you are going to be limited to how much tissue you can take away. Because if we do take too much tissue away, we will start impinging on the attachment, and then we'll get either a grow back of the tissue or a chronic inflammatory response, or that reddish ring that sometimes we see when we place a crown or restoration that is impinged on the biologic attachment. So here you see we're just a little touch up. There's a little pigment on the tip which is being just sort of marked onto the tooth surface. We keep the tip moving. The amount of heat generated by the laser will not have an effect on the tooth if you keep the tip moving. And we're just sort of cleaning up some tissue tags and just getting our length just the way we want it, just going back and forth to create that nice little appearance of a little longer length to those anterior teeth. Remember to wipe the tip as you are doing the procedure, and then we'll go in and start to use a little chlorhexidine to actually clean that little pigment or clean up the little tissue tags on the teeth. So here we've started to clean the tissue up a little with the chlorhexidine little micro brush. As you can see, that's going to remove any of that little pigment or stain that was caused by the laser, and it's also going to help remove any little tissue tags that may be left when utilizing the laser. As you can see, it gives the tissue a very nice appearance. Doesn't really even look like much was done as we clean that up. Now, if you do have a little larger tissue tag, sometimes you can also take a scaler or curette to just remove that as you're doing it. And we're also going to go over the right anterior teeth, which we had done a day prior, and you can see that's healing up very nice. I would expect this within days to be completely healed.